Look, there's a lot of hope that in the new year, millions of Canadians might receive some COVID vaccines from Pfizer and Moderna if they get approved from Health Canada. But as you just saw, while 3 provinces are promising people specific numbers and doses in a January timeline, the federal government is saying, slow your roll here. Why will they not confirm the specifics? In fact, the parliamentary secretary to the Minister of Health told me on CTV Power Play this past week, he doesn't even know where the Ontario Minister of Health is getting her numbers. So why all the confusion on the most important issue facing so many Canadians? Are the provinces raising false hopes to avoid dealing with the dire COVID situation? Talk about that and the rollout plan. We begin today with the Minister of Public Services and Procurement, Anand. Minister, let's start with vaccines because there's a lot of confusion between the provinces and the federal government on this. Should Canadians trust, for example, the Ontario Minister of Health, Christine Elliott, when she gave specific numbers that Ontario will receive 1.6 million doses of the Pfizer vaccine, 800,000 doses of the Moderna in the first 3 months of 2021? Is she right?
We cannot specify the numbers or delivery dates specifically, other than that they should be in the first quarter of 2021 if all goes well, because the key point is when Health Canada is going to approve these vaccines for distribution. It would be imprudent for me to say specifically what the numbers are to each jurisdiction. What I can say is that we are in negotiations and discussions with the provinces and territories and across government to ensure that when a vaccine is approved by Health Canada, it will be distributed. Rest assured, we are putting in place logistics systems to ensure that we can indeed distribute. Along the lines of refrigerators and freezers. We have procured 126 freezers in particular that can be stored at very low temperatures to accommodate the Pfizer and Moderna vaccines.
Okay, there's a lot of information there, so and I'm really glad to get the facts, but it is a significantly different message than we heard this past week. So, you know, you've got Dr. Dina Henshaw, the medical officer of health in Alberta, saying specifically that province will get 680,000 doses of COVID-19. And again, Doug Ford and Christine Elliott in Ontario say, hey, we've spoken to people, we know how many we're going to get, and we know we're going to start rolling them out. So where are they getting these specific numbers? Are they simply spitballing and extrapolating based on the aggregate number of vaccines that the federal government has procured?
There are negotiations and discussions occurring at the current time, and it is my estimation that that is exactly what is happening, extrapolating from the very preliminary conversations that we are having with the provinces and territories. From a procurement standpoint, Evan, what's really important to recognize is that we are putting in place the logistics and distribution system so that the vaccines can be transported to the provinces and territories once they are approved by Health Canada.
But Minister, Pfizer's already said they'll be able to roll out vaccines within hours of approval. Again, the opposition is asking you time and again, when will your government tell us what the distribution plan will be? How many vaccines will be made as soon as Health Canada gets the approval? When they'll get distributed? And who will get them first? Why is that plan? I mean, we could be weeks away from having this. Why won't you release that plan?
Well, Evan, let me just say that there is a process for developing and finalizing these plans. And part of that process is having the conversations with 13 different provinces and territories who have governments in place that are in charge of distributing healthcare in those provinces. It would be highly imprudent for Anita Anand or any other minister in this government to simply dictate what a plan would be without ensuring that those negotiations have occurred and that the provinces and territories are well on side with the distribution plans. And that's the level of conversation that's occurring right now.
Okay, but I still don't know when, and it could be weeks away. You said you've procured 126 freezers. The freezing is going to be a big part of it's called the cold storage chain of this vaccine, as you well know.
Yeah.
How many do you need to vaccinate every Canadian? What's the target freezer number, and when will you get it?
Well, we have, as you know, procured 20 million of the Pfizer vaccine that must be stored at minus 75 degrees Celsius. And so what we have procured right now is we've put 2 contracts in place for the purchase of 26 freezers at minus 80 degrees Celsius and 100 freezers at minus 20 degrees Celsius. And this is in addition to existing federal capacity in this area. And overall, we have the capacity to store up to 33.5 million ultra frozen and frozen vaccines.
I know they're in the freezers, but they'll require trucks and freezers. So do you have on the chain, do you have the trucks that can deliver those at that temperature? Again, if this thing goes, you're going to have to snap into action. The need is so intense. Are you confident that you'll have that in January?
Evan, with all due respect, I am quite aware of the logistics that need to be put in place for the vaccines to be rolled out. It's what I'm working on every single day, just as I did with PPE and vaccine contracts.
I'm not asking if you're aware. My job is to make sure Canadians are aware we haven't seen the plan.
Exactly. And as I testified at committee this week and have continually come forward with the information relating to our contracts, including explaining $6 billion worth of contracts on our website, Evan, we are providing as much information in real time as possible, because when a vaccine is ready, Canada will be ready also. It is my mission, and I'm determined to see it through.
Minister, it's always great to have you on the program. I really appreciate it. Thank you so much.
Thank you so much, Evan. Take care.